My name's Colin Perry. I am a student volunteer at McGregor Memorial EMS in Durham. I'm a senior life science and agriculture major in microbiology, minoring in genetics. So when I was 16, I took a first responder class at the local hospital in Colbert, New Hampshire. So the first responder is your first medically trained person to arrive on scene of a medical emergency. They're trained in your basic medical interventions, CPR, your basic splinting stuff, generally stabilizing your patient for either to be signed off when the ambulance gets there or to be transported to the hospital. 17, I took the EMT basic classes, which is next level up from first responder. The basic curriculum is a little more advanced than the first responder, but the big difference is actually it's a transporting license. So a first responder is not actually allowed to transport a patient to the hospital. On top of all your CPR and stabilization, your splinting and all that kind of stuff, your EMT basic can also provide advanced airway management. Give up to, I think, a dozen medications. As far as patient assessment, it goes more into anatomy, physiology, and gives you a better idea of what's wrong with your patient. I got my certification in June or July of 2005, and then I came to UNH at the end of August. And I was looking to get involved in some type of extracurricular activity. Tried a few of them, and I wasn't really that thrilled by any of them. And I know my brother, when he had went to school here, he actually joined the Durham Ambulance Corps. So that's when I decided that I may want to look into that. Since I already had my EMT license, it had worked out. So I started doing that, and that's been my main extracurricular activity for the past 4 years. Last year I continued on with EMT stuff and became an EMT intermediate. Again, it kind of builds on top of you're able to do all the skills that your first responder and your basic can do, but then you're also given more details again into anatomy and physiology, and you're able to get another dozen or so medication, and you also run as what's called ALS, or Advanced Life Support Units, which pretty much means for your real more critical patients you're able to do a lot more successful interventions, like starting IVs, giving IV fluid, and it also helps to get your patient through the healthcare. Then in July of 2008, I enrolled in a paramedic class in Manchester at the New England Institute of EMS. It's a 18-month program. Your paramedic is really kind of what you think of as your true pre-hospital care provider. They really are just an extension of the emergency room physician, and they're allowed to give all the drugs that are given in an emergency room. I took the first responder class mainly because it was something new. I had always played sports in school, and where I'm from, that's really all you can do. So I wanted to try something different, and once I actually started doing it, I got really, turned onto it, and I've always kind of thought that medicine, nurse, doctor, that kind of thing, is something I may want to do as a career. So that was my initial reasoning for becoming a first responder, and then actually going through the first responder, basic, intermediate. The reason I kept going through those ranks was I really wasn't satisfied with the knowledge and the amount of interventions you can actually perform, because you get to a point where you see people of your higher levels doing all this stuff, and you're like, I could do this just as easy, and I'm really understanding what I'm doing. So it was just time to move up. So typically for me, starting on Monday, my Monday, Wednesday, Friday schedules, I have classes from 9 to 1, and then depending on the day, either I'll do homework or something like that after class, and then on Monday nights I go on call from 6 p to 6 a. And a typical Monday night, probably have 2 or 3 calls, usually between 1 and 4 or 5. We're able to sleep, but especially older people. We live in an older community, especially a lot of the nursing homes and assisted living places. Right before people go to bed, it's usually when they start having breathing problems or any type of medical problems usually happen before bed. So usually any time between 9 and midnight, we get a rush of calls. Usually in this area, it's a lot of difficulty breathing and your chest pain, and typically for 911 we do, I would guess our average patient's probably 60 years and older.